Hi, I'm Dr. Muhammad Asif Ali from Royal City Clinic. I'm a general physician with a special interest in the management of diabetes. I'm here today to discuss a few things about Ramadan and diabetes. As you all know, we are approaching Ramadan in 10 days and nearly 120 to 140 million Muslims around the world are taking on fasting. So it is very important and prime to bring an awareness how to take on fasting for the people who are diabetic. Now coming to the point, I get a lot of questions like what happens during Ramadan, why we need to change the medications, how should I do the finger prick test, what exercises can I do, what foods can we take. So all these questions come to us. So I'm just bringing an awareness and trying to answer a few questions. What happens to the sugars during the Ramadan? Usually after your fast meal, after 8 hours, your body glucose is utilized and your body starts using your stored glucose. This is quite normal and not harmful in many people. But in case of diabetics who are taking medications, like insulin and other anti-diabetic medications, it can be risky and it can lead to hypoglycemia. So therefore, it is essential that the patients go for a pre-Ramadan counseling. What is pre-Ramadan counseling? This is nothing but a consultation with a doctor at least a month or 2 months before, wherein a doctor will assess a diabetic patient based on his age, type of diabetes, HbA1c levels, then what type of work he is doing, what type of medications he is on, any comorbid conditions. Based on this, your assessment will be made and a proper advice will be given. So this counseling is very essential if a complicated diabetic patient is planning for taking on fasting during Ramadan. Now another point we want to start here is fasting. What are the benefits of fasting? So coming to the benefits of fasting, it is definitely a low calorie intake. You can plan and try to lose weight. It can help and also regulate your diabetic sugar controls. You will start losing weight. Then this is also a good period if somebody is planning to stop smoking, they can stop smoking, because there is a lot of restriction, nearly 14 to 15 hours, so they can definitely plan for stop smoking. And also during this period you can have a good relationship with the physician with repeated consultation and try to regulate your diabetic medications and everything. Now what are the complications? Complications basically are dehydration if you are not taking too much of water, hypoglycemia, which is prime, hyperglycemia, high sugar, and also sometimes called diabetic ketoacidosis. We are also talking about the questions of which diabetic patients can avoid fasting. The patients who should avoid fasting are a type of diabetes called type 1 diabetes, which is a bit complicated. Patients are on insulin. And the next is pregnant women who are diabetic, they should avoid fasting. Patients who have frequent hypoglycemic attacks, they should avoid fasting. Patients with chronic kidney disease on dialysis and other patients who have acute illness or some serious illness for a short time, they should avoid fasting. The next point is, they ask us about finger pricking check. Yes, you can do a finger prick check as frequent as possible. There is no problem with that. What type of exercise you can do? Exercise, yes, try to do vigorous exercise. It is always better to do exercise early in the morning, immediately after sahur, a mild exercise, and also just before the iftar. These are the two good periods to engage in mild exercise. What food alterations? Regarding food, what one should eat during sahur and during iftar? So here basically in sahur we always advise to take some foods which are slow in digestion, and usually we call it as low glycemic index foods, which can be wholemeal bread, fruits, vegetables, legumes, and also fish, lean poultry, meat and all. So try to avoid very high carbonated drinks, high sugar drinks, and during iftar you can restrict yourself for 1 or 2 dates. Then take lots and lots of water and simple carbohydrates like cereals, pasta, a bowl of rice. This can break your fast, and you can follow up with your doctor for further modification of your medications. Now coming to the point, what type of medications and what type of diabetics can take on fasting. Usually type 2 diabetics who are well controlled can take on Ramadan fasting, and also there are some medications which a doctor can assess and give a complete clearance for you to take on fasting, like if a patient is taking only glucophage or some sort of second generation sulfonylureas. There are some categories of medications which a doctor can definitely inform you and bring a complete assessment based on which you can start fasting. So my dear brothers and all the viewers, I request you to kindly make an assessment before you take on fasting, so that you can enjoy fasting, get a maximum benefit out of fasting, and happy Ramadan for you people. Thank you.
Royal City Clinic, a caring mission.